Hey everyone, this is Gabe Solomon. I was going to do a very informal introduction to the new Outpatient TurboNote. Please excuse the quality of this video as I'm kind of doing this on the fly. So you can access the tool from the Tools menu of CPRS. You can click on Outpatient TurboNote in testing. As you can see, the TurboNote will pop up instantaneously. But it will be loading information in the background. So you can start typing your note while the tool is loading. It's in the background. And on the top of the note, you'll see some helpful information such as the patient name, their last four, their date of birth and age, what their address is, what their phone number is, what primary care team they're on, what % service connection they have, as well as their code status. And then everything else kind of is free text. So we have an HPI, which is entirely free text. We have a review of systems where you can click 10 of 14 reviewed, or you can left click if something is positive, right click if something is negative, click again if you want to get rid of those things. If you feel like it's just taking up too much room, you can kind of collapse it if you don't want to see all that information. Again, the past medical history, the family history, and the social history are all kind of free text. It is important to note that these are essentially considered widgets, and they will update in either the outpatient or inpatient setting. So if the inpatient team updates the past medical history, you'll be able to see the changes they made. And you actually have the option to either go back to what you had typed in previously or to accept those changes. Again, sometimes these are free text, sometimes they're kind of radial buttons. If you want to have a quick way of getting your past social history from your previous note in, you could just paste the whole thing into this other category and that will be fine. Again, none of these are required. Some of these things will come into play later on in the smart aspect of the TurboNote. For example, if someone is a smoker with a long or smoking history, it will trigger the lung cancer screening and things like that. So it is helpful to fill this information out. Just click a few things so you can kind of see what it looks like. We have kind of illicit drug section, we have marital status, we have residence, we have occupation, sexual history, military history, travel history, and I'm open to putting more things on there if you guys want. And then the next section is the MedRec section. And essentially, what this is a master list of medications from all around the country, kind of organized in kind of a helpful way. So all of the indications are pre-populated, and you can see all the blood pressure meds are together, all the blood thinners are together, all the pain meds together, etc. And then you can also just purely sort alphabetically if you like. You can sort it by status if you like, or you can just put it back to indication, which is kind of my preference. You can see what their total daily dose is. You can see how many refills they have and when they last filled the medication to judge their compliance. And if you go over the little magnifying glass, you can get a sense of like who prescribed the medication and just more detailed information. And then you can also write non-VA prescriptions here, so you can expand this control here to show kind of some of the other features. So if you wanted to write a prescription for, amlodipine, you can do that, and it will kind of quickly print a VA prescription. When you do print that, you can also copy it into the clipboard, and the tool will also state that you did create that prescription today. On the left side, there's some filtering options. So this is really important if someone has remote medications that aren't very important. You can hide them. And so you can also hide and show supplies. Kind of we have them hidden by default. So the test strips and the alcohol prep pads and things like that aren't on there, but you can add them if you'd like. On this side of the tool, we could have the nurses or us be entering whether or not the patient's taking this information, yes or no. Medication, yes or no. So the options are yes, they're taking it, no, they're not taking it as prescribed, this is a duplicate, or this is completed. And these If you don't want to enter anything in here, you don't have to. But if you do enter stuff on this column, it will affect the SMART note down the road, and I'll kind of go over that at the very end. The next section is the vital signs section. So you can see, you can filter these by, last week, last 30 days, last 6 months, etc. If you loaded the tool and there's updated vital signs, since you updated the tool, you can just refresh each section. That's kind of a universal feature. You can see if something's been updated, you can kind of update a section rather than having to upload up and change the whole note. The weight, this is a test patient, so they don't have a lot of weights in there, but the whole lifetime weight will be on there in a graphic form, so you can see the yes and no. In the future, we hope to be able to make that also blood pressure, heart rate, etc., BMI, whatever you want to click and graph. The physical exam section is kind of a mix of free text down here and templated text. So again, similar to the review of systems, you can left click for patients in no acute distress. They're oriented ×3. They have a regular rate and rhythm, normal S1, S2, no murmurs, rubs, or gallops, lungs are clear, etc. And so right clicking is a negative, left clicking is a positive. And you can reset them all if you'd like. Okay. If you want to describe a wound in detail, there's just a separate section for that. The next section is the labs and studies section. So you can see that there's also a way to control how much of this information you're seeing. So if you want to see less information, you can kind of go by 1 year or less, if there's too much information, if they've been admitted or something like that. And all the stuff is preloaded, so the tool should be pretty responsive. And then we've kind of broken things down into panels. So we always kind of have our comp, coags, and CBC first. Then we have like a diabetic panel, we have an endocrine panel, we have ABG, we have a GI panel, cardiology panel, an ID panel, urine panel, etc. And I can show you kind of what we've put into each panel, and I'm open to feedback on what these panels should look like. If you I'm trying to make it so every single important medication is in these panels. There are other labs that you can see on here that are not on a panel yet, but we will probably get them on a panel. And then on here we have the studies and procedures section. So you can kind of view all the studies that you would want by rolling over the little magnifying glass. If you want to add them to your note, you can simply do that. It will add the impression to your note. Again, if you want to filter those down, you can do that up here. Again, I just want to also emphasize that this is all JLV information. So all the labs, all the studies, all the medications are from every VA around the country. So it helps you in terms of looking up medications or studies that were done at another facility. We also have kind of a micro and pathology section, so you can kind of see what the results are for a particular culture was. If the culture has sensitivities, it will be on there as well. You can type a summary on there and put that into your note if you would like. You can also mark things as positive or negative. The tool will actually mark them positive or negative already, and you can unclick it if it was a false positive or something like that. All right. So then we have kind of a free text plan at the bottom. If you're using this and you want to just do a quick note, you could copy your old assessment and plan into this section. And here is an example of no appointments for this test patient, but these are the future appointments over here. And below the free text assessment and plan is kind of the SMART note. And you can toggle this on or off up here. So if you don't want to use it, you don't have to use it. If you just want to use it for reference and looking at things, you can do that too. I do think as you get used to this, it's going to be really helpful to use these SMART sections, and we can kind of build these out together as a team and figure out what we want to have in each of these sections. But each of these I've kind of broken down into like a main section, so like a cardiovascular section, a diabetes section, etc. The tool will actually have a free text at the top, and right here is where I'd want you to just put in, what are the problems associated with this box. If there are too many, you have the ability to create another box, but I would try and lump as many as you can into one box. I find that it's actually okay to do that for documentation. And then it's going to have the cardiology lab panel on here, the comp. It's going to have everything you need related to cardiology on here, right? So if you want to see what the echo was, if you want to see what the stress test was, those kind of things will be kind of automatically brought in for you. You can see the tool automatically brings in the medications that are related to this section, so you don't have to type any of this stuff, so it will bring in the medication and the total daily dose. And then you can type in the following sections here. If there's prescriptions, you either are going to enter what prescriptions you're doing, or you can say no, or you don't have to put anything in there. If it's blank, it won't be included in your note. You could say I reviewed the stress test from 2018, rather than kind of put it in your note. And then at the bottom you can have your comments, and again you can type in whatever you want, or you can copy the plan for your old notes here as well. I just want to note that these first section and the last section will stay with you as you open the note over and over again, while these middle sections will be updated kind of each visit. Just one more I'll go through. The diabetic panel has the A1C, the microalbumin. It brings in all the diabetic meds. You can tell what prescription changes you're going to make. It automatically brings in the ACE and ARBs in this field. It brings in the gabapentin type medications in this field. It brings in any cholesterol medications in this field. There's a retinopathy section, which if he had an OPTI visit, will show kind of the results of the OPTI visit. There's a foot screen section, which will show any PACT-related foot exams. These two sections we'll have to work on a little bit to make sure they're showing us what we want. Then these are diagnostics. If you don't want to order anything, then you don't have to. Comments again here. And then we have kind of GI liver section, we have dermatology. Basically whatever meds they have will create these sections. We have a pain section, which will show you the most recent tox screens, what they're on for pain medications. It will actually show you if they have a narcotic agreement on file and when it was signed, and it will also show you if they've had Narcan and when that was last filled. Okay, so I won't go over all these things, but I will show you that if you want to move a section around, you can simply drag it so that you can kind of order these things in however you would like. You can drag them up, down, sideways, etc. And if you do, notice something that you don't want on there, like for example, maybe you don't want to talk about the BMI at today's appointment, you can remove that section and it will just kind of delete it out there for you. You can also add new sections and you can title them whatever you want. We're talking about adding different filtering options for these smart notes, so you can pick and choose which ones you display. However, I do find it extremely helpful that if I'm seeing a patient, that it puts all these medications into these boxes, and you basically just have to look for an explanation for each of these things. So you could move this box, up if you need to, and order the note however you want. Whatever order you have the smart boxes in is the order it will appear in your note. And then this section is just really helpful. So we have kind of a health maintenance section as well. And in this health maintenance section, you have kind of a list of all the immunizations. Again, we probably will put in, what site these immunizations are coming from, what was given today or what you plan to give. There's a colon cancer thing with, when was their last colonoscopy. It tells you what the path shows. The tool will actually break out what type of polyps were identified in that pathology. And then you can decide if you're going to order a FIT test or a colonoscopy and in what time frame. And so this will be all put into your note for you. You also have the option of documenting either an outside FIT or a colonoscopy test on there. Prostate cancer screening, again, similar idea. This will show your PSA. we also have it set up that if there was a prostate biopsy or a prostate MRI or something like that, that you'd be able to document it on there. We have kind of a lung cancer screening, which will show, Tanner's score here, which we'll probably need to figure out how we want to display that. But it will also show like any CT scans, any chest biopsies, and things like that. And so that's essentially the SmartNote. At the end of the visit, you also are able to create an after visit summary by clicking on the button here. If you want to, you can go and create a customized med list that shows, these are the changes that I made today, like these are new, these are stopped, etc. And then you can print the after visit summary. You have the option of creating a customized after visit summary by, if you want labs on there or anything to do with antibiotics, or just by default, it's going to have your future appointments, PCP, vitals, vaccine, and what was ordered for you today. When you click print on that, it's a relatively quick way to print an after visit summary. I will say you can also circle print after visit summary on the checkout sheet, the clerk will do this for you. So there's no need to do this yourself if you'd rather have it show up on the clerk's job. Okay. Okay. At the end of the visit, you can copy to clipboard, and that should be very quick, actually. And then when you copy to clipboard, it will create your note for you. And I think you'll find that, the note looks pretty nicely formatted. This is the test patient, so it doesn't have a lot of things in there. But you can have to type in a lot less than you would have if you had done the note by hand. I think on average, a primary care note's about 1,000 words. I think you're talking about, somewhere typing in 50 to 100 words using this. So I know starting a new note and things like that is starting a new process like this can be kind of anxiety provoking. So I'm looking forward to working with you guys. Maybe we can work on, making this a lot more efficient for everybody. I'm open to, changing the tool kind of in real time as you get feedback from you guys, and I appreciate your feedback. So the tool is live on the tools menu as of today. So please feel free to look at it and give me feedback. Okay. Thanks. Bye.